Thank you, Dr. Osterholm. In the federal budget world, we deal with polarization often, and it keeps really good budget solutions from coming to the forefront oftentimes. And I've been reading a lot about your area and vaccinations and so forth, and I'm afraid we're seeing some of this polarization as it relates to vaccinations as well. So I guess one of the questions I would ask you is, what do you say to the folks out there who say the vaccinations did no good? This Facing the Future podcast is nonpartisan, but unfortunately, attitudes about the vaccines, it seems, are not when you kind of dig into
Yeah,
the
yeah.
polling numbers. And so, how can we overcome this?
Well, let me kind of take that apart piece by piece because you packed a lot in that really good question. Number one is the fact that you're absolutely right. The whole vaccine issue has been very polarizing, and that's terribly unfortunate because based on what are really some very conservative studies, we estimate that maybe as many as 300,000 people in this country are alive today because they got vaccinated that wouldn't have been. Okay. So, I mean, right there, the vaccine has real benefit. At the same time, there are a number of people, and we're in the thousands. We're talking about almost an equal size number of people who didn't get vaccinated, who died unnecessarily. And that was been demonstrated over and over again. It's very prominent in the red states, in particular the red counties. And these were all largely unvaccinated people. So I guess the proof is in the pudding as to what, the outcome is. What does that mean about the vaccine? But what you've hit on is a really very, very important inflection point in public health. I've spent the last 30 years of my career fighting vaccine safety questions about, does it cause measles virus cause autism, the vaccine cause autism, et cetera. And in fact, much of the misinformation out there about vaccine safety has held parents back. But it's nothing like we're seeing now. What we've been able to determine is over the course of the pandemic, and really it was an outflow of the situation with mandatory vaccination programs, the public, a sizable number, have said, I'm not going to get the vaccine for myself or my kids or any of vaccines for that matter, because it's not about safety, but don't tell me what in the hell to do. It's a streak of independence. And so we've never dealt with that before. We've always acted in good faith of saying, you make these recommendations with the idea that it's to save people's lives. It's not to, you recommend, don't go over Niagara Falls in a barrel. Okay. That's not a good idea. Okay. But they say, don't tell me what the hell to do. I'm going to go do it. I want to go ride a barrel over Niagara Falls. And so I think this is a challenge we have right now. How do we address this? And we don't know how to do it. But let me just tell you as an example, as a harbinger of things to come. 3 years ago, Europe had about several hundred cases of measles in kids, and it was a big challenge. And Europe has been kind of in the forefront of the anti-vaccine movement. Right now, so far this year, we've had 68,000 cases of measles in kids, of which a large proportion have been hospitalized, a number have died, and it's all tied to non-vaccination. And, we're going to see that here in the United States. It's just a matter of time. We have the same levels of kids not vaccinated, and that number is growing every day as parents won't get them vaccinated. And so we're only at a little over 150 cases here in this country so far. Mark my word, within the next few years, we're going to be Europe deja vu all over again.